Hello, I'm Dr. Rich Brown. In my 25 years of practicing family medicine, I've seen so much suffering and death because of behavioral risks.
These risks are responsible for 40% of deaths and most chronic disease in the United States, and behavioral disorders, such as depression, add to the burden. Every year across our nation, these issues generate $900 billion in costs, including $300 billion in healthcare costs.
In the past, these issues were regarded as peripheral to mainstream medicine. Now it's clear that systematically addressing these issues is central to effective and cost-effective healthcare. For example, in preventing or better treating chronic illnesses such as diabetes, hypertension, and heart disease. We can do this by systematically screening and intervening for these behavioral issues.
The process is called BSI. My research at the University of Wisconsin has shown that it's feasible and effective to integrate BSI into busy primary care settings, emergency departments, and hospital inpatient units. In fact, doing so is the largest step these settings could take toward the triple aim of improving health, patient experience, and healthcare cost control. So please allow me just 5 more minutes of your time to explain more about BSI, the business case, and how Wellsys can help you implement BSI. Here's how BSI has worked best in the 50 diverse healthcare settings I've worked with. In primary care settings, receptionists ask patients annually to fill out a screening form with about 10 questions. Medical assistants who check vital signs quickly review patients' responses. For patients with responses that indicate risk, medical assistants make warm handoffs to on-site dedicated health educators. Those health educators have the time and the special training to build relationships with patients, conduct assessment to determine severity of risks or disorders, deliver interventions or referrals, and provide follow-up. In hospitals, health educators simply introduce themselves and deliver services. For patients with behavioral risks, health educators intervene with motivational interviewing, an empathic, respectful, collaborative, and evidence-based approach to promoting commitment to change. Motivational interviewing generates high patient satisfaction even when patients decide not to change for now. When patients do commit to change, health educators help them refine personal behavior change plans over time to meet their behavior change goals. For depressed patients, health educators administer evidence-based collaborative care. They educate patients and instill optimism for treatment. They coordinate any necessary referrals. They contact patients regularly to maximize adherence to treatment. They engage patients in activities that help lift depressive symptoms, such as exercising and socializing. And they track changes in depression symptom scores monthly, so they can alert others on the treatment team when progress has stalled and the treatment plan may need modification. Hundreds of studies have shown that BSI improves outcomes. BSI generates a 20% reduction in emergency department visits and a 37% reduction in hospitalizations for the 1 in 6 American adults who are binge drinkers. BSI boosts depression remission rates at 1 year from 30% to 54%. For smoking, the leading cause of preventable death in the United States, BSI increases 1-year quit rates from 6% to 28%. BSI also generates substantial cost savings. We see a 400% return on investment for alcohol services in 1 year. There is no better healthcare bargain. We also see a 480% return on investment for depression services over 4 years, and greater return on investment for tobacco services over a longer time period. For each patient who is screened and then receives appropriate additional services, employers in Wisconsin save $895 in the first year because our binge drinking rate is so high, and employers in other states save on average $775. And more savings accrue in future years. As our nation moves toward value-based healthcare financing, settings that implement BSI will realize other important advantages. Primary care settings will meet dozens of patient-centered medical home criteria. Hospitals will reduce readmission rates and satisfy increasing Joint Commission and CMS quality measures. ACOs will better address 14 CMS quality measures and generate ample shared savings. All entities at risk for healthcare costs will improve their bottom lines. And with BSI, you'll improve outcomes for diabetes, hypertension, and other chronic disease, meet increasing mental health, alcohol, and drug parity requirements, and gain a competitive edge with purchasers. Because of all the evidence on effectiveness and cost savings, BSI is recommended by many national and Wisconsin authorities, yet seldom delivered. I established Wellsys to help make BSI routine in healthcare settings across the nation. Wellsys is a spin-off of WIFL, a University of Wisconsin-based program I direct, which has helped 50 healthcare settings implement BSI since 2006. 2 federal agencies have recognized WIFL for its excellence. Wellsys has helped about a dozen additional clinical settings implement BSI through the Pathwell program. The Pathwell program helps you select health educators. We train those health educators in implementing research-based clinical protocols, monitor their performance, and provide ongoing support and development so they become true behavior change experts. We advise you on best practices to maximize the numbers of patients who receive BSI without hindering other patient flow. We equip you with unique software that guides health educators as they deliver services, engages patients, prints out visit summaries for patients, generates documentation and billing information, and enables complete BSI population management. And we train your staff on submitting fee-for-service claims for reimbursement that's increasingly available under healthcare reform.
I hope you now have some clarity on how BSI and the Pathwell program can help you meet your clinical and financial objectives and satisfy increasing regulatory requirements. Thanks very much for listening. If you'd like any additional information, please email or call me.